So I'll turn it over to Mona. She'll be discussing supporting frontline workers, burnout, and self-care. Thanks, Mona.
Perfect. Thank you, Bahar. Hello, everyone. Lovely to see a lot of familiar names. So today I'm just going to be actually focusing a lot more on the work that you're doing and how you're supporting yourself, taking care of others. Because I think that Rosa did an amazing job talking about how to support victims of violence. So that's going to be my goal, although I'm just going to quickly touch over some of the things that, I also just reiterating, I guess, what Rosa has been saying. But in terms of just supporting clients, I think one of the key things as frontline workers is that sense of awareness, right? The ability to have knowledge and resources to be able to offer clients who are coming to you for support. And as you know, there was a wealth of information that Rosa has presented in terms of the safety plan and the knowledge that BWSS exists. And I have used that resource several times throughout my work. So having that knowledge base is extremely important, as well as acknowledging our own self-biases, right? And we all have those. We all have biases that we think in different ways, right? So for example, talking about, catching yourself in the way that you think about a client coming to you and presenting some notions of having potential domestic violence or emotional violence that's occurring for them in their life, meaning that what comes to your mind right away, right? Do you think, oh, well, this is a private family matter, right? So that's a self-bias that is important to acknowledge and check in with yourself, right? Rosa made a great comment in terms of culture doesn't allow for violence, right? Meaning it's not an excuse for violence, right? So just being aware that, in situations that are extremely life or death based at some points, it's really important to understand where your understanding and awareness comes from in terms of your own biases, right? And also being aware to making sure that you are presenting an ally stance with your clients, right? So whether I remember having a simple poster by BWSS at my desk, and having built a rapport with a client for several months. And it was only when the client saw that poster that she felt comfortable enough to kind of start speaking about what was happening with her in her family life and in her relationship. So demonstrating an ally stance, I think, is extremely important as well. Another part of it is building a trusting relationship. So again, that rapport that Rosa was speaking to, right? Creating that non-judgmental listening, right? Being attentive. There's a lot of, I don't want to say paranoia, but mistrust, right? When it comes to service providers or workers, right? Because, sometimes those were individuals that were not able to be trusted, right, in the past. And as we said, for example, situations where clients have had difficulties having any sort of trust in the police, in their home country. And so carrying that with them forward, right? And so the ability to create that rapport, to be able to reassure them that, you are there for them and you are able to create a safe environment and you're able to create confidentiality for them, right? And again, another point that Rosa had made was about that reassurance that they're not responsible for the abuse, right? And I think that one of the things that always comes to my mind is that victims of domestic violence are surviving every single day, right? They are using different survival strategies to cope with their situation on a daily basis. So acknowledging that, right, and empowering that and kind of moving forward in the way that they are hoping to, are just kind of the things that, again, to be mindful of when we are supporting clients of domestic violence. And so when we're trying to think about boundary setting, so I think this is one of the things that's really hard for frontline workers, because you are in the business of helping, right? You are in the business of wanting to give and to share as many resources and provide as much assistance as possible, especially when it comes to more vulnerable populations, right? But, one of the important aspects of giving that compassionate care is boundary setting, right? It's about being able to know what you can actually say yes to, right? And having that knowledge and clarity for yourself allows you to move forward in a healthy way by being able to offer those supports, right? And compassionate people always know what they need to do, when they can say yes, and when they need to say no, right? To be able to say yes to other things. And these boundaries are what actually keeps them compassionate, and it's what keeps them from getting resentful, right? Towards things like compassion fatigue, which we'll talk about in a bit. And it's not just what I'm saying, right? There's a wealth of research around that. One of the more famous names and is someone called Brene Brown, and she talks about how boundary setting really is about compassionate care, right? So great. How do we do that? Well, it's important that knowing what you can say yes and doing that, right? And being proactive about it, right? So being able to be very clear and direct in terms of your message, right? I think that sometimes we want to be perceived as caring people, and we want to be perceived as nice, and we don't want to disappoint people, right? So our message becomes a bit unclear in saying that, well, I can try this, even though that potentially it's not really going to go anywhere. So I think it's important to have that kind of clear message to be able to gain the trust of clients, right? And to be able to back your boundary with actions, right? Meaning that if you create a boundary, acting on it, right? And in that way, you are teaching others that when you say yes, you mean yes, and when you say no, that sits as well, right? And lastly, like I said, to be at peace with your boundary, right? To be in a situation where you are comfortable in yourself to say that this can't be done, or this is the line that needs to be drawn. I think this is a quote probably that all of you can just take a minute and think for yourselves about, right? Meaning that you can't pour from an empty cup, which means that your cup for yourself, your resources, your replenished resources need to be there in order for you to be able to serve and provide for others, right? And so self-care has become a real buzzword, right? I'm definitely positive that being in the type of work that you're doing, you've all heard about self-care, right? And about all its benefits. So yes, you can manage stress better. It increases your resilience. It decreases mental health issues. So there's a wealth of information about self-care, right? And so when I was thinking about coming here and speaking in regards to how to handle and take care of yourselves when you are dealing with very vulnerable situations and populations, I thought, well, I don't want to be redundant, right? You guys already know about self-care, but I guess my message is really, how do I take you from that kind of knowledge of self-care to actually applying it and making that into creating that into an action for yourself, right? Because if there's one message that I really want you to take away from my presentation, it's that self-care is a necessity at this point. It's really not a luxury, right? And so my hope is that, we can move forward in kind of really thinking about what are some of the ways that this can be applicable in our lives versus, again, understanding that, okay, self-care is good for you, because I think most of you would agree that it is, right? But it's that, how do we move forward with that and think, well, how can I incorporate that into my work? How can I incorporate that into my life? And, just to give you kind of a bit of background, previous to this pandemic, 1 in 5 Canadians suffered from a mental illness, right? And just in July, the stats have come out that currently that number has increased in Canada to 3 to 5 Canadians, right? So there really is a health issue involved here. And it's not just about this buzzword. And we're talking about preventative measures, right? To take care of yourself. So what is self-care? Well, it's not just taking a hot bath, right? And again, we talk about, doing a weekend getaway or taking a hot bath or, going to get, I don't know, your nails done, whatever it may be, right? But self-care in actuality is a bit deeper than that. And it's in 2 ways, right? It's really something that is done with intention, right? So it's an activity that is able to give you joy. It's able to give you that kind of re-energized notion for, okay, yeah, having done this activity, I feel better. You come out of it feeling in some ways restored, and it has an ability to reduce your stress, right? And the other part of it is that it is practiced regularly, right? So this is not about, you doing it once and hoping that, it's going to kind of pull you over for the next month or 2, right? It is something that has to be done with intention for taking care of yourself and reducing stress, and it's something that needs to be regularly done, okay? So we know there's a lot of different types of self-care, right? Mostly I think people really talk about the physical self-care, and that's associated with our physical health as well. So whether it's, making sure you get 8 hours of sleep or, drinking water or exercising, which is all great. However, there are other parts of you, and those parts also require and need kind of nurturing, right? So whether it's the emotional part that, requires some creativity on your part, or the spiritual part that needs some nourishing, and whether that's being in nature or doing meditation or practicing, religious books or whatnot. There's the mental part, that kind of mental stimulation, right? That gets your thinking going, right? There's that social, and I think we've all just really come to recognize what that social aspect has really meant once those things that we took for granted kind of went away with the pandemic, right? And the other part of, I think probably the least known part of self-care is the practical aspect, right? In that organizing, right, can give you a good sense of, feeling like, okay, you're getting some stuff in order, and that in itself can definitely be a part of self-care. So it's always good to kind of be holistic in terms of when you're thinking about doing different pieces of self-care for yourself. Now, again, back to my point about, the caregivers that you are in terms of the work that you do. It's the obstacles to self-care, right? That I'm really wanting to project here and really wanting to influence you in regards to. And kind of thinking about, okay, what are some of the obstacles? Why are people not practicing self-care if they know that it's good for them, right? And I hope that I'm wrong. I hope that you are practicing it. But having worked in the sector, I definitely know a lot of individuals who are amazingly compassionate, and they are giving, and they do so much for others. And sometimes they have a hard time reflecting that back to themselves, right? So doing those same things that they're doing for others and wanting others to do for themselves back to them. So, one of those mindsets is the giver, right? That the Mother Teresa mindset, meaning that, it's just better to give, and other people are more important. And, this equation that we have of, self-care being selfish, right? However, when we think about that, and we think, the example of, back in the day when we could actually fly somewhere, and you get on the aircraft and they're doing the safety thing. And the oxygen, they're talking about the oxygen max, and they're saying, if it drops, put yours on first, then help somebody next to you. And, sometimes your automatic response would be like, well, that's selfish. Like, of course I'm going to help the child beside me or the old lady sitting beside me to help them put it on, right? But what happens then when you're in the middle of doing that and you yourself pass out? So you haven't been of use for yourself and you haven't been of use for anyone around you, right? And I think that's really the key here, in that if you are not taking good care of yourself, you are by extension hurting others, right? So it's actually the exact opposite of being selfish. And that kind of reframing is important for us to think about, right? The superhero mindset, the idea that I am indestructible, I am able to take on anything, and I can handle everything, and this is not an issue for me, right? And unfortunately, it's with this mindset that a lot of times we start to get physical symptoms, right? Because the way we are thinking is a bit stubborn, and so our body starts to show that actually, no, you are not a superhero, and I'm feeling this, right? So you start having chronic pain, you start having a whole slew of physical ailments that are actually associated with this lack of taking care of yourself, right? So it's that your body is kind of sounding the alarm, saying, some things need to change, right? The other obstacle to self-care, time restraint. And I think we can all understand that. I can definitely understand that. Being working at home and having my 22-month twins at home as well, it's hard to think about, okay, how do I keep this notion of self-care, and how do I think about myself when there's so many other things that are on my list to do, right? But the truth of the matter is that if I'm not doing that, then I'm also not being able to give the same level of concentration to my work, to my kids, to my family, right? And that in itself, again, is an important reframe, right? Because in order for you to be able to give in the level that you want to be giving to others, it is important for you to prioritize yourself. And I'm not talking about, every day spend half the day for yourself, right? These are increments of time that you are able to put away for yourself. If it means, having 1 hour, half an hour, right, in every day for yourself, whether it's reading a book or doing a puzzle or whatever it is that, gets you re-energized, right, and kind of de-stresses and decompresses you, that's all you need, right? And I think that we can all put that amount of time for ourselves to be able to be healthier and to be better in terms of how we do all the things that we need to be doing. Another part of it is that perceived value, right? Some people don't see the value of self-care, and with that, I think it's going back to those key ingredients in the sense that self-care has to be very intentional and has to be done regularly, right? And I always love comparing that to our physical body, right? So if I'm standing here and I'm saying, I would love to lose 10 pounds, and okay, I know I have to eat healthy and I have to exercise, and I do that for one day and I don't see a result, it would be really irrational for me to say, well, okay, this is not working, right? So we understand that in our physical sense, right? But we have a lot of difficulty sometimes transferring that over to the way our thinking is happening, right? In the sense of it has to be a bit consistent for us to really see the benefits of that, right? And the other part of it is a kind of lack of role models, right? We haven't really seen our caregivers or our parents be able to take care of themselves and do self-care, right? And so we've kind of carried that with us, and we haven't learned that behavior, right? And sometimes we don't have the supports to motivate us to take care of ourselves when we're not able to do it, right? So I do want you to kind of just take a minute for yourself and think about, what are those obstacles that are in your way that are not allowing you to take care of yourself, right? Because you really do owe that to yourself. And again, by extension, to your community, right? Whether it's your family or whether it's in the work that you do, to be able to be in a situation to take care of yourself so you can again take care of others, right? And so what happens if you don't? Well, when we're talking about our professional quality of life, we seldom talk about compassion satisfaction, right? And it's we talk about compassion fatigue a lot because that's what seems to happen, right? And again, that's the results of not being able to kind of balance ourselves in terms of doing things for ourselves and others. So compassion satisfaction is that feeling when you get, when you've kind of helped out somebody, right? And when you've done some fulfilling work or when you've kind of made a difference, right? Compassion fatigue is kind of on the other side of that, right? In terms of just feeling a bit overwhelmed, that you're not necessarily being able to take on, all of the things that are coming at you in terms of the need for your assistance and the need for your help. And I think anyone who's kind of been in the sector for some time really knows that compassion fatigue is very easy to fall into because there's such a great need. There's a great vulnerability in terms of clients' needs, and there's a huge lack of resources, right? And so those two always equate to kind of it falling on the shoulders of frontline workers to be responsive and to answer, why it is that things are not moving along the way that is expected, right? And so, unfortunately, if that continues, if your compassion fatigue continues and is not really addressed and looked into, what happens is that you tend to burn out, right? And compassion fatigue is actually relatively easier to kind of reverse, right? It's a bit more, I don't want to say superficial, but it's a bit lighter, right? Versus, burnout is just really that overwhelming feeling of being mentally and emotionally and physically exhausted, right? And so we see that, in terms of a bit of a shutdown in being able to provide at the same baseline that we were providing services before, right? And vicarious trauma, these are all usually used interchangeably, but they do mean quite different things. And vicarious trauma is really about, well, we know that trauma, you can experience trauma in two different ways. So you can experience it in a direct way, so the trauma has happened to you, and you can experience it in an indirect way, right? Meaning that you have seen something, you have witnessed it, or that you have heard stories, right? So when you have clients coming to you and they are describing, horrible situations that they've been through, or, violence that has been committed towards them, right? It's actually the ability to have symptoms of that trauma just by hearing it is there, right? So it's really a stress reaction, meaning that those symptoms present themselves and are able to take you in a situation where you are trying to be of assistance versus, kind of taking in that trauma yourself and start to have symptoms of it. And so what tends to happen is that, there happens to be an overload when we're thinking about, compassion fatigue, less, but specifically when we're talking about burnout and vicarious trauma, and that there's a moral distress, because what happens is ultimately there's a shift in our cognition, meaning that, we have a hard time thinking about, what is it that we're really doing, and are we really making a difference? And it seems that it's too much sometimes for us, and it's too much to be able to carry this heavy load and weight with us. And again, these are what we see when we are not practicing self-care. So yes, perhaps this is a scare tactic for you to be able to practice a bit more in terms of doing more self-care, because I truly believe that, when we talk about our health, mental health is really important, a key factor in that. And that if there are things that we can do to prevent further illnesses or disorders, then we really owe it to ourselves and all of those around us to be able to do that, right? And again, in terms of the work that you are doing as frontline workers, being mindful about when you start seeing those signs of compassion fatigue, right? When is it that you start feeling like, you're having difficulties concentrating, that you're becoming a bit irritable, that you almost don't want to pick up the phone because you don't want to hear about another problem that, you don't necessarily have enough resources to deal with, right? So being mindful of what are those key things that point that you are experiencing compassion fatigue, right? And kind of starting to think, okay, well, if this is the case, then, what am I going to do for myself? What are some of my self-care tools that I can start doing? Whether it's, going out for a walk, or whether it's whatever your self-care kind of list is, right? And being able to really incorporate that for yourself to be able to move past it, right? And again, we are talking about preventative measures, right? So ABCs, looking at the work-life balance and trying to figure out, okay, how do I incorporate self-care in all of that, right? So awareness, always key, right? The ability to be able to do self-check-ins, right? To check with myself, okay, am I experiencing this right now? What's going on with me? And it's always a bit surprising as to, how seldom we do check-ins with ourselves when we are working, right? And again, because it goes back to that, there's so many things happening, there are so many needs that we need to address, that our own need kind of falls through the crack, right? And it goes back to those, set of mind frames that, okay, I can handle it, it's fine. But again, going back to, we are looking at this in a preventative way. And if we really want to take care of ourselves, are we able to do quick check-ins and like, how am I feeling? Okay, do I need a break? Do I need to take a walk? Do I need to do something for myself? Even if it's for a few minutes, even if it means, just pouring myself a glass of tea or, cup of water, whatever it may be. Doing that check-in piece with yourself throughout the day is a really good way of kind of being able to draw you into that moment and making sure that you're okay to be able to continue your work, right? Balance. Again, it's a hard one, but important, because being able to kind of maintain a healthy work-life balance. And especially during this pandemic, when all these lines are completely crossed, because we've been at home and our office can be just our kitchen table or whatever it may be. But being able to know that we still have our breaks, know that we still have to take a lunch break, know that we are able to just, shut off our computers at 5 p.m. and everything else can really wait for the next day, right? Because there is that other piece of life that needs to be taken care of, right? And in terms of connections, right? So connecting with our social supports in a meaningful way, right? And being able to gain a feeling that there is a community out there, right? Whether it be in your family, whether it be in your social networks, whatever it may be, that sense that you are not isolated, right? And that includes your professional community as well, right? I know that some have come to me saying that, they find it really difficult not having that kind of interaction with their teams, right, on a daily basis that had nothing to do with work. Those few moments where you joke about something or you talk about something else, that is just a bit of a self-relief, stress relief, right, in moving on with your day. So still being able to kind of maintain those connections in some form of way for it to be meaningful. How you think about the work that you do really matters, right? It's really interesting. There's this great research about, they had looked at about 10,000 people, and they saw, and they kind of divide them into, individuals who had a lot of stress, individuals who had, just very little stress. And they looked at, how their health was going in the span of a year. And at the end of that, they were asking a series of questions throughout the year. And they actually found that, people with a high level of stress did not necessarily mean that they would have illness, right? Chronic illness. It meant that how they thought about handling that stress was really important. So the way that you think about your stress and the way that you think about the work that you do is really crucial, right? Because if you think that it's too much and that you're overwhelmed, that means you're not really addressing your needs, right? And by not doing that, that's when you start getting into the situation of creating some unhealthy behaviors, right? So asking yourself, why is it that you do this work, right? And this is essentially where that kind of meaning and purpose of your work comes in, right? So reminding yourself that, there's always a different path that you can take if you really don't find that you are gaining the same meaning from your work. And all of you are doing this work because there is a humanitarian aspect to it, right? Definitely not in it for the money, right? No one in nonprofit really is. And so making sure that that sense of meaning and purpose is still really valid for you, right? And kind of being able to, again, look at yourself and check in with yourself and kind of remind yourself of why you got into this work in the first place, right? So with that kind of comes into looking at the bigger picture, do you know what you're doing in your work and why, right? What is kind of that framework that you've created for yourself, and do you still see yourself in terms of being able to contribute to positive change, even though you can't really see that change sometimes immediately, right? How do you measure success in your work? What are some ways that you feel that you are doing the kind of work that you want to be doing, right? What can you be controlling in your work? And there's always something, right? There's always choices that we can make in our work, and there are always certain things that we can control. And I think this is important to say, because a lot of times we tend to focus on things that we can change. So a lot of good energy is wasted on our kind of complaining about things that we are not in the power to change, right? Or we're not able to change. So kind of being able to shift our focus into what can I control? What can I change in the work that I do, right? And what are the costs and rewards of this work, right? How am I personally changing? What are some of the benefits that I am getting from doing the work I'm doing, right? And what are some of the costs that I can kind of address and look at and kind of shift around and change if possible, right? So that, again, I can be doing the best work possible, but also being able to take care of myself, right? And my needs as well. And how you do your work matters, right? So, making changes and choices that are possible, again, for the better, right? And that things that, bother you, whether it's, your the way you set up your desk, or, the times that you go for lunch, or whatever that could mean, that you are in the ability to change some things for the better, and to make that change, right? The other part is being able to connect or disconnect with people, right? If you are consistently busy and talking to people, then maybe taking a bit of time to say, you know what, this hour is allocated for paperwork, or, you know, taking a break instead of going to, you know, the lunchroom, going for a walk by yourself, right? Versus if you're doing a lot of work alone, being able to kind of connect with others and go for a coffee, or do something that kind of connects you, right? To be able to try different things at work, right? So seeing if there's opportunities, right, to be able to do different things in your work if you feel yourself that you're getting kind of a bit restless or bored, or you know, it's about kind of that curiosity of, you know, how can I turn things around? How can I shift things a bit for myself to be able to do my work in a way that makes me happier, right? Um, Being able to regain perspective throughout the day, and that kind of ties into, again, that check-in, right? Being able to kind of sit with yourself and say, okay, how am I doing? What's happening? Am I, you know, do I find myself that, you know, I'm able to kind of take a minute and just pause and do something for myself to be able to continue the work that I'm doing, right? Invest in professional networks and relationships, right? Such as today, right? All of you have attended this workshop in order to be able to gain more information and knowledge, right? To better serve your clients, right? And doing these things not only connects you with other colleagues in some ways, right? But also gives you that sense of kind of collaboration and that sense of community and networking, right? And also accessing services that are available to you with your organizations, right? For example, I think the majority of organizations now have EAP, which is the Employee Assistance Program, and they provide counseling. And so you simply, you know, and it's completely confidential. Your employer will never know that you accessed it. But if you're finding that you are kind of dealing with situations of vicarious trauma or compassion fatigue, or even burnout, and especially burnout, to be able to, you know, speak to a counselor and get some tips and tools on how to address that specifically for yourself, right? Or things like workplace debriefings, right? I've been part of that for organizations to be able to kind of, with teams who've had kind of some issues with, you know, the demand of the work, especially during the pandemic, to be able to sit and kind of work through some of those frustrations and things like that. So making sure that you are accessing these services. And so the takeaway message for this is definitely, you know, almost everything will work again if you unplug it for a few minutes, including yourself. And I love this because I think it's a really good reminder of how we're able to do that for ourselves, and how we're able to kind of, it just needs a little bit of time for ourselves to be able to replenish. And if we can give that to ourselves, if we're in a position to be compassionate towards ourselves, we'll see that a lot more good will come, not only for ourselves, but again, by extension, through our community, our work, and our families. So I'm really hoping that as a takeaway, as your homework, you know, you can think of just one thing that you can start doing for yourself, to be able to take care of yourself and to be able to practice self-care, and kind of do that with intention and do that regularly. And I guarantee you, you will see the outcomes of it, and you will see the good that will come from being a bit more compassionate towards yourself in the way that you are with others. So thank you for that.
Thanks, Mona. Oh, there's my, okay. So that was a great presentation. A lot of reminders for
There's a
me.
lot of push on, you know, take care of yourselves.
Yeah, and also, even now working from home, I mean, I don't work with clients one-on-one, but all those tips were good for me too. And I think there was one point that you said, like, why am I doing this work? Like, why am I, that's such a good question to ask yourself. And I think that brings you back to your purpose. And then that kind of, for me, would, you know, it rejuvenates me. Like at the end of it all, why am I doing this? And it's my favorite part of my work. But enough about me. I have some questions for you.
Sure.
So we talked about this when we were talking about this webinar, actually, is that during COVID-19, it's brought a lot of us working from home. So we're working from home and we're also supporting clients in their home. So it's kind of
Mhm.
blurred a lot of these boundary lines. So how do we kind of reinforce those boundaries? Because it's a lot harder now to leave it all at work, you know? We are in our homes, in our bedrooms, working with people, and then we
Yes, yes, we are.
and
Yes.
so how do we how do we create those boundaries again with clients, and also just like in our minds, like, okay, I'm leaving this very difficult situation where like someone has just told me they are in a domestic violent situation, and that they're, you know, describing things to me, and then now I have to step outside my room and go be with my family. So
Yeah, exactly. And I'm not sure if you can hear it or not, but you know, those are my twins in the background making lovely noises. And that's the reality of it, right? And I think that's, you know, that's where a bit of self-compassion comes in terms of understanding that we are collectively on a global level going through a pandemic, right? Meaning that everybody in one way or another is feeling the repercussions of this, right? So first and foremost, that transparency, right? Of saying that, you know, things are going to be a little different, but yet these are kind of the new guidelines in terms of, you know, how I can assist you and in what way, right? Be very clear about your message and direct, right? And you know, again, it goes back to that concept of, you know, what are boundaries. Boundaries are essentially you knowing what you can say yes to and knowing what you can say no to, right? And being okay with that. And I think that as as helpers, we have a really difficult time being okay with it, because again, we don't want to disappoint, we don't want to seem like the bad guy, we want to be helpful, right? But at the same time, we have to have that balance, right? So yes, I don't have an office that I can leave right now, right? But I do have a laptop that I can close, right? And that can signify for myself, I'm done for the day, right? So kind of associating these small things that you can do for yourself, right? To signify that, okay, your day is done, right? Whether it's setting an alarm that says, you know, 5 o'clock, and it's, you know, something that comes on that's saying, okay, it's time to pack up, right? Because we don't have the same cues anymore. We don't see people like packing up and leaving, or, you know, the office closing, right? So we have to actually create that for ourselves, right? And we have to be able to be okay to stick with it. And again, we need to be okay to stick with it, because one, we have other responsibilities at home, they still haven't disappeared, right? And two, we are still working within a box in terms of, you know, what our responsibilities is, and what we need to do at work versus, you know, the other parts of our lives.
okay, and then I guess my second part to that question is, you know, there are many managers listening as well, you know,
Mm-hmm.
frontline staff, we have a combination, right? So as organizations, how can organizations support their frontline workers, both during COVID-19, but also in general, especially when there's more multi-barrier cases that frontline workers are dealing with? And one of the things that are in there is also domestic violence. So it's like,
Mm-hmm.
you know, compact, especially with refugee clients, there's usually multiple barriers like that, multiple issues that we're dealing with. So how can organizations support that?
I think organizations are doing a good job in terms of providing um, more tools that are really needed during this time, right? More self-care tools, more workshops, right, for staff to be able to just come together and kind of be able to gain some tools, whether it's, you know, dealing with anxieties and you know, being able to set boundaries or being assertive, and all of those pieces, right? So I think that's definitely a really good way for organizations to support their teams. I recently did a debriefing with a team who was dealing with this exact issue, right? They saw they're not specifically really trained in domestic violence, but they had seen a huge hike in domestic violence abuses happening, and they were really overwhelmed in terms of how to deal with it, right? So we did, debriefing sessions in terms of being able to come together, as a team, and myself to be able to say, okay, what is happening here, and how can we kind of look at it from the perspective of ways for us to be able to deal with the repercussions of that, right? And I think things like that are really critical at this point, because again, we're not only before we talked about self-care, before the pandemic, we talked about self-care and it being important, and it really was, especially in the work that we do. But with everything that's being added on to the current situation, I think that becomes even more vital. So those are just some ways.
I want to add that since COVID kind of started in March, we had to work remotely, and we have like around 20 staff members who had to go and work remotely. But something that we always do at the office is that at 9 a.m. we all meet and have our check-in, debriefing. So what we did is that we continue doing it through Zoom. So we just decided some days let's have it at 9 and other days at 4 p.m. So that has been huge for keeping people debriefing, connecting, getting support, and a sense of, even though you're at home, you have a team that is supporting you. So I don't know for other organizations, but when you ask what organizations can do, I think that at this time it's very important that organizations provide like an ongoing way of supporting people, because otherwise working from home, and sometimes you end doing more than you should be doing, or some people don't do anything and then they just pretend that they are doing something. Let's be honest, right? So it requires level of commitment, accountability, and self-care, right? Because there are other people like me that I can be working 24/7, right? So I need to also have my own limits and boundaries. So connecting with a team of people is very helpful to stay grounded, and also protocols, right? Because there are many things that you didn't have before that now are coming up. So organizations need to review protocols all the time.
Mm-hmm. And I think both of you mentioned debriefings. I think like with Mona, having the experience of being a frontline worker for 15 years, and now she's a like full-time mental health professional, like going into organizations and doing those debriefings is so important, just because I think a lot of times you bring in a consultant and they don't necessarily understand the frontline work that happens in the sector. We're so involved in all aspects of a person's life, from settlement to their family to mental health, finding employment, all of these things. So I think having the debriefings is a really great idea. And I really, I don't know which organizations are already doing this, but many probably are. So kudos to them for, taking this step and already like being proactive to provide this support to their frontline staff. And I have another question which relates to domestic violence. And, with mental health, there was a lot of stigma discussing it with clients, especially from different backgrounds. And I find that with domestic violence, obviously, it's very similar. There's a stigma to even discuss it. It's kind of a secret. So I remember with mental health, a lot of organizations started doing like workshops generally just to spread the information, and calling it by different names, like family workshop. And in there, they would work in, mental health information, resources, types of things. So do you have any suggestions for how organizations can kind of bring up the topic of domestic violence so that it does create an open space for clients to discuss it or find the resources they need without having to say like, I'm in a domestic violence type relationship, or I'm experiencing domestic violence, or I think I'm experiencing domestic violence? Like, any suggestions there?
I don't know, that's a hard one for me. It's a hard one because the organization Battered Women Support Services has been providing services for 40 years. So 40 years ago, the women who started the organization decided to call the organization Battered Women Support Services because that was a way for them to expose that violence against women was happening and to break the silence. And even in 2020, many people kind of have questions about our name. It's not like, oh no, you know, like battered women sounds horrible, right? But that's happening in 2020, right? It's huge. So maybe Mona has a better answer when it's more for your kind of your sector where you have more like men and women if you want to make it. But even as for us as feminists, when this issue of domestic violence or family violence came up, is gender neutral in the sense that it's as if women and men are as abusive as, or everybody is abusive, right? And the reality, as I said, is according to the criminal system, 80% of the crimes committed against women and children are committed by men. So we need to address that.
Yeah, I would definitely agree with that. And I think, you know, like you mentioned, Rosa, the title in terms of how, you know, we say it, and for you, it's important because that's what the resource is, right?
Yeah.
And I think that, you know, people also appreciate having that as well because they know that, you know, that's a place where it's a, you know, they can get a lot of resources and help essentially, right? In every aspect, virtually. But I think when it comes to kind of doing any preventative work, especially, you know, with populations such as refugees, right? Where there is a lot of stigma associated to, you know, putting it under things such as, you know, effective communication and parenting skills, right? And kind of giving the information, but under a different title is a bit less attacking, and so you're creating a space where potentially people can listen more and can kind of get more insights, right? And again, where I guess my stance is that regardless of, you know, the title, it's really that information that's valuable, right? And how do you share that information? Because sometimes it's not necessarily about, you know, what you're saying, it's about how you're saying it, right? And how it's coming off. And it doesn't mean that we want to coddle, you know, abusive behavior by any means, right? But it's about creating a space for being able to share information, right? And I know there's you know, a colleague of mine does groups where men come and get free haircuts. And that's where they talk about abuse, and that's where they talk about, you know, violence, right? And that's very effective because that would never work in the sense of, let me have a support group for men to talk about violence. Nobody would show up. And we've tried that, right? So I guess it's okay to lure people in to be able to give them the information and the tools to be able to talk about that. At least that's my stance.
Perfect. We're a couple minutes, well, we're 4 minutes over, but I'll just keep you for a few more minutes just to answer these last few questions. So thank you to everyone that stayed, but we'd like to kind of finish off these questions. So this question's for Rosa. Does BWSS work with clients outside of the Lower Mainland, for example, Vancouver Island?
Yes, something that I forgot to share is that also because of the pandemic and knowing that violence in intimate relationships was going to increase, then we decided to open our services 24/7. So we went ahead and decided to start answering the intake and crisis line 7 days a week, 24 hours a day. And it's so great because also with Zoom, we continue our training for our intake workers. And now we have a bunch of people who are helping with the crisis lines. So what we notice is that many women from all over BC started calling our line because I guess they were trying other places and didn't get a response. And then they were calling us. So Yeah, we have been providing support to people in all over the place, Victoria, Prince Rupert, in different areas. And again, our services are confidential. When they call the crisis line, we provide the basic information. We do safety planning, safety assessment. Even sometimes we connect with resources in their community, so to ensure that they access the right support.
Okay, so the other question is a woman is often physically assaulted, choked, and they don't want to leave, and their spirit has been broken down, but they are scared for their life. What's important info to tell this woman at that point? Like they want to leave, but they're just so broken down that they don't think they can, or they
Mhm.
won't.
Yeah, so, and I know Mona is also a counselor, so, in healing takes time, right? And she may, like, if you want to call it, her spirit is broken, right? Like maybe she is exhausted and she's at a point that is hard to regain the energy. So she needs to support. She needs support to regain that energy, right? And every human being I have met in counseling or through doing support work, everybody has this flame that keeps you going, but sometimes you get exhausted, but the flame doesn't go away, right? So how can we as a support workers or counselors can help her to recover and to regain that flame? And when Mona was talking about self-care, I think it starts from self-care, right? What are the steps that she can take to take care of herself so then she can go back to the core and get to the skills and strengths that she has to make the decisions that are going to improve her life, right? And in my work, because our services are open for as long as the woman needs the service, I know in some organizations people have limited sessions. Sometimes it's just one intake, or the person only can access 5 appointments and that's it. With us, if they are not ready now, they can access later. So in the 16 years that I have been at BWSS, I can tell you that your work makes an impact, right? Because maybe you don't get to see it in the future, and that's why some people get burnout or tired, because sometimes you do all this work and you don't get to see the changes in the future. But that person may come to our organization and say, oh, this worker from immigrant services helped me a lot, gave me a lot of information, but at that time I was not ready, but now I am ready. So that's why I'm accessing your support, because she gave me your information, right? So I think we need to be patient and understand that people have their own resources, right?
Yeah. And I would just, I agree with Rosa completely, but I would also add that just acknowledging where they are, right?
Mm-hmm.
Being very transparent in terms of acknowledging and understanding and saying, just empathizing. Hey, I can see you're exhausted and you are so tired from all of this. And then using empowering language, right? Saying that, you've come a long way and you've done this and this and this, and kind of and that shows so much resilience, and kind of being able to acknowledge the fact that they are exhausted from the experience, but also empowering them with language, right? That kind of highlights their strengths, right? Because again, we are in a field where we're continuously focusing on the problems, right? And sometimes we miss highlighting the strength, the immense strength that the clients show and exhibit, and sometimes they don't see it themselves at all, right? So when they have a person, on the outside that reflect that back to them, I think that's something definitely that can potentially be powerful and helpful in allowing them to move forward.
Thank you both. It's 11:40. I have a frog in my throat, so it's time to go. We've had a lot of messages in the chat saying thank you for your presentation, for all the information you both provided today. I will send everyone the PowerPoint decks, and I've recorded the session, so I'll upload that to YouTube and also put that on our website, a link, if you want to share it with your coworkers or watch certain parts again. And I'll send it out through our e-newsletter, and I have a list of all the registrants as well. And I'll also be sending out an evaluation form by email as well. So any final thoughts from Rosa and Mona that you'd like to leave with us?
Self-care.
Well,
That's all.
yeah, self-care and yeah, women, people, children, families need your support, right? We are needed, and something that Mona was saying in her presentation is when people tell me, oh wow, how come you have been working for so long doing this work, and how come you don't get impacted with the stories that you hear and the horrible stories you hear? And I said, you know, what keeps me going is hope, because my work impacts and affects change, right? My work, whether it's planting the seed or contributing to transforming someone's life or contributing to stop violence against women and children, then my work is meaningful, right? And it's very important to remember that we are needed, that we chose to do this work because we have some level of commitment towards the people who see us, and that even the people who attended this workshop, I imagine they register with the Refugee Hub because they care. They care about their work and they want to learn more or to find a place where they can be with others in this journey. So thank you for joining and thank you for inviting me.